What feature favors a real liver lesion versus a pseudo lesion? Rounded appearance, a vessel that goes through it, subcapsular location.
How come no one else is guessing?
Vessel.
Sorry.
Vessel goes through. I'm sorry. B.
Okay.
I would say A.
A, B, okay. Anyone for C? No? Okay. Okay, so this was a patient who came in for a liver lesion that was found on ultrasound, and the patient had a triple liver protocol CT. Okay, so there's arterial. Here's the venous and the arrow sign. And then here's the delayed. So what do you guys think this is? What's your DDX? Or maybe no DDX?
We think vessels go through it, so it could be like a regenerative nodule, focal sparing.
Yeah, right. So yeah, there's background hepatic steatosis. I'm not showing you the spleen. Maybe I should, but it's lower attenuation than the spleen. So there's background fatty liver, and then there's that subcapsular lesion where there's vessel going through it. So there it is. So focal fatty sparing. So here's a case where there's an ultrasound. The liver is hyperechoic in the background, and there's this hypoechoic lesion, subcapsular location. This was the corresponding CT. This is the that area that corresponds to the hypoechogenicity in the background fatty liver that was consistent with fatty sparing. And there's no mass effect. These are called pseudo lesions because they do, look like lesions. They mimic lesions. It's a pitfall. So pseudo lesion, they they can contain fat. These are typically in characteristic locations. So adjacent to the falciform ligament, in the porta hepatis, gallbladder fossa. And they think this distribution is because of a anomalous venous drainage, like, I guess, gastric venous drainage that sort of characteristically affects these locations. Also, absence of mass effect on vessels or other liver structures, geographic configuration rather than rounded or oval shape. You don't really see the margins well, and the contrast enhancement is similar to the background. So in patients with insulinoma there's also been a description of focal fat deposition adjacent to the Mets due to local insulin effect. So here is a case. So here, this is an MR in and a post phase, right? We have the Indian artifact, so this is a post phase. What do you think about this lesion? Okay, I'll give you more. No, I shouldn't give you more. So I'll give you the answer.
Well, it's either focal fatty sparing or true lesions that are sparing fat.
Okay. And then here's the pre-T1, and then here's the contrast enhanced T1. So what Artie was saying, sorry, so for the residents that are listening, so here's the background liver, and on the post phase, it gets darker. So that it shows that there's background hepatic steatosis. But if you look at the lesions, the signal doesn't change. So it doesn't have fat. That's all we can say from this image is it doesn't have fat. Sorry, go ahead.
So we think that they're probably areas of focal fatty sparing. We want to see like vessels going through them and make sure that there's no other. But even on like your post contrast, those are fat suppressed images. So given the degree of fat on the out of phase, the background liver is going to be suppressed. And so that's why they could look bright on the T1 pre. And then enhance just like a piece of liver that doesn't have as much fat in it. So just even though it looks T1 bright and it looks like it's enhancing, that could still be just focal fatty sparing.
Oh, I see. Okay. Well, I mean, this was in the paper itself, so I'm going to just tell you it's enhancing. I mean, we probably need the subtraction images to
But even focal fatty sparing should enhance because they're liver. So we need to look at all of the
I see
different.
what you're saying. Yeah. So no, well, these are the only 4 images provided on this paper, so I can't give you any more images. But the other information that they provided was that it was stable for 2 years. It was stable for several years, not 2 years. So anyways, the paper, that same paper, said because of the rounded shape of the appearance and the location, right? This is not subcapsule. This is not the typical distribution for focal fatty sparing or focal fat. And it was enhancing. This was most likely an adenoma. But sounds like maybe Artie doesn't agree. Maybe she does. I don't know.
She doesn't.
No, we believe you.
No, you don't have to believe me. It's the paper. I think. Interesting. So they thought it was an adenoma, and the one thing you can tell, at least if it was an adenoma, is that it's not the HNF1 alpha, right? The one that contains fat, because it doesn't drop out signal on a fat. So the feature that favors a real lesion versus a pseudo lesion is the rounded appearance. So these two, as well as several other features, suggest, or you should consider a pseudo lesion in those situations.